Lateral ankle sprains are the most common sprains in sports. Today, we will explore a specific injury in a basketball jump shot, which is the most common lateral ankle sprain. Lateral ankle sprain is caused by an inversion injury at the ankle joint, which may cause a tear of the ligaments attached to the ankle according to the degree of sprain. The lateral ligaments involved are primarily the anterior talofibular ligament, calcaneofibular ligament, and the posterior talofibular ligament. Next, let's take a look at the etiology of a lateral ankle sprain. One of the causes of ankle sprain in basketball injury is bad landing after the jump shot. It usually occurs when the person lands one of the foot on another person's foot. Now the right foot externally rotates about the axis of the other person's foot and undergoes plantar flexion, causing the foot to land on the foot side. The foot inverts sharply before undergoing internal rotation and dorsiflexion, which causes the ligaments to overstretch. Another reason why ankle sprains are experienced by basketball players is because of their previous ankle injuries. Players with a history of ankle injuries are 5 times more likely to re-injure their ankle. Another factor that causes ankle sprain is inappropriate footwear. According to Wright, footwear with air cells have been shown to cause ankle sprains in basketball players when they perform a jump shot, as the air cells in the heel of shoes create a thicker midsole and reduces one's awareness of their foot's position during sports. Here is an example of comparing the differences between the two types of footwear. These two pictures show the knee pattern of basketball players at takeoff phase. The left picture shows the knee flexion when one wears a suitable basketball footwear which doesn't have air cells, while as you can see that the picture on the right shows the knee flexion when the player wears a pair of shoes with air cells. When the person jumps, there is a decrease in knee flexion and the foot will experience a greater impact force, which easily causes ankle injuries. Lastly, people who do not stretch before engaging in basketball are 2.6 times more likely to injure their ankle. The lack of stretching and warm-up will cause a lower flexible ankle and increases the risk of overstretching the ankle ligaments.
Chinese! Get the game!
Now we will discuss how protective measures can reduce the acute occurrence of a lateral ankle sprain. High-top shoes can limit extreme range of motion by restricting the ankle from twisting in a plantar flexion and inversion form and reduce external stress. Prophylactic devices such as taping, bracing are used to prevent recurring ankle sprains. These devices help to wrap the ankle joint from the foot segment to shank segment and limit the range of motion at the ankle. To prevent ankle sprain, equipment such as the Bosu Balance Trainer can help to train balance by minimizing reliance on arms, hips, and knees. Strengthening the muscle stabilizes the ankle. Such exercises include resisted plantar and dorsiflexion, resisted eccentric inversion, and calf raises. Warming up is important. It increases the body's temperature, promotes blood flow and oxygen to muscles, and increases speed of nerve impulses as well as range of motion at joints, hence reducing the risk of tearing muscles and ligaments. A recommended duration for warm-up is between 15 to 30 minutes. The next video will show examples of warm-up exercises. Exercise rehabilitation. The degrees of ankle sprain are classified to grade 1, 2, and 3. To prevent further injury, the first thing to do for grade 1 ankle sprain is PRICE, which stands for Protect, Rest, Ice, Compress, and Elevate. Compression is applied to minimize swelling. It is normally done together with ice therapy. These are the strengthening exercises to prevent further ankle sprain. The following tables show each of the summarized action and duration for ankle sprains rehabilitation according to the degree of sprain. The higher the grade of sprain, the longer the time required for the ankle ligaments to heal. In grade 3 ankle sprain, non-surgical options such as bracing or injecting stem cells are conducted. Surgery is needed only when the sprained ankle is a distal talofibular ligament third-degree sprain that caused the ankle mortise to widen in order to restore the ankle mortise. The respective rehabilitation weeks for all 3 grades generally take up 8 to 12 weeks. Through this video, we have covered the etiology, prevention, and rehabilitation of a lateral ankle sprain. Thank you.